INICET November 2025 Recall Surgery. Question number 1. All of the following statements are true about Peutz-Jeghers syndrome except A. Inherited as autosomal recessive disorder. B. Polyp shows arborization on histology. C. Associated with extraintestinal manifestation. D. Hamartomas polyps. इसका आंसर है A. Inherited as autosomal recessive disorder. Second question. A 60-year-old patient presents with bone pain and easy fatigue. Serum calcium is elevated, phosphate is low, and SAP is elevated. X-ray shows diffused osteoporosis. Which of the following investigation will be useful for the confirmation of diagnosis? A. PET scan. B. Sestamibi scan. C. Bone marrow biopsy. D. Triphasic bone scan. इसका आंसर है B. Systemic scan. Question number 3. What is the most common site of Barry aneurysm in circle of Willis? A. Anterior cerebral artery. B. Middle cerebral artery. C. Basilar artery. D. Vertebral artery. इसका आंसर है anterior cerebral artery. Question number 4. A patient with hypothyroidism has recently completed a 13-14 hours long flight. Which of the following are risk factors for pulmonary embolism? Number 1. Hypothyroidism. 2. Prolonged immobilization due to long flight. C. Smoking. 4. OCP. इसका आंसर है C. 2, 3 and 4 are correct. Question number 5. A 20 years old male present with pain in RIF for the last 24 hours, diagnosed as acute appendicitis. Which of the following is correct about his condition? A. USG is IOC in children. B. McBurney's point is a classical site of tenderness. C. Ochsner-Sharon regime is used in appendicular lump. D. Prompt appendectomy is done after conservative management in all the cases. इसका आंसर है D. Prompt appendectomy is done after conservative management in all the cases. Question number 6. Arrange the steps of hernioplasty. इसमें क्या होगा? A. इसमें steps लगाने हैं. A के बाद क्या आएगा? B. B के बाद C and C के बाद D. इसका एक correct order है. Question number 7. Match the following investigations with pathologies. A. Manometry. इसमें मैच करना था. इसमें आएगा A के बाद A का सेकेंड एक्लेसिया कार्डिया. B का आएगा 3 GERD एंड C का आएगा 1 सेस्टमेवी स्कैन. इस तरीके से मैच ऑफ द फॉलोइंग होगा. Question number 8. A 17 years old female presented with recurrent abdominal pain for the last 3 months. On laboratory investigation, amylase and lipase was raised. USG shows normal GB. MRCP image is given below. What is the most probable diagnosis? A. Cholitical cyst. B. Annular pancreas. C. Pancreas divisum. D. CBD stone. इसका आंसर है A. Cholitical cyst. Question number 9. Which of the following gets the first priority in triage? A 45 years old unconscious patient with noisy breathing or grunting. B. A 23-year-old conscious patient with breathing difficulty. C. A 6-year-old crying child. D. A 60 years old conscious patient with blood-soaked pants. इसका आंसर है A. A 45 years old unconscious patient with noisy breathing or grunting. Question number 10. Which of the following is correct about Hirschsprung's disease? Number 1. Failure of migration of ganglion cell. Second, causes intestinal obstruction postnatally. Number 3. A proximal segment constricted. Number 4. Non-coordinated peristalsis. इसका आंसर है C. 1, 2 and 4 are correct. Question number 11. Identify the procedure. A. Biliopancreatic diversion. B. Roxanne-Y procedure. C. Gastric bypass. C. Duodenal switch. इसका आंसर है D. Duodenal switch. Question number 12. A patient with recurrent history of gastric ulcers presented with severe pain abdomen. On evaluation, a small mass is found on the anterior wall of the duodenum, which investigation will help in the diagnosis. A. Insulin level. B. Gastrin level. C. Urea breath test. D. 24-hour pH monitoring. Answer is B. Gastrin level. Question number 13. A patient present with abdominal pain on evaluation. Patient has raised mucin and CEA levels and normal amylase. What might be the diagnosis? A. Cystic neoplasm of pancreas. B. Pseudocyst of pancreas. C. Mucinous cyst neoplasm of pancreas. D. Intraductal papilloma of pancreas. Answer is C. Mucinous cystic neoplasm of pancreas. Question number 14. Tiagro classification is used for A. Acute pancreatitis. B. Chronic pancreatitis. C. Acute cholecystitis. D. Pancreatic cancer. Answer is B. Chronic pancreatitis. Question number 15. A child spilled hot milk on his hand. Image of the burn is given. Identify the degree of burn. A. Superficial partial thickness burn. B. Full thickness burn. C. Deep partial thickness burn. D. Superficial burn. इसका आंसर है A. Superficial partial thickness burn. Question number 16. A woman presented with the following findings in left breast since 3 months and pain since 2 months. What is the management plan for the following? A. Simple mastectomy followed by management of complications. B. Neoadjuvant chemotherapy followed by radical mastectomy. C. MRM followed by radiotherapy. D. Neoadjuvant chemotherapy followed by MRM. इसका आंसर है D. Neoadjuvant chemotherapy followed by MRM. Question number 17. A patient has undergone laparoscopic cholecystectomy. A drain was inserted because of difficult gallbladder dissection. Day 7, drain output is 300 ml. Patient is febrile and CT doesn't show any collection. MRCP shows cystic duct stump leak. What is the next best management? A. ERCP with or without stent. B. USD guided pigtail catheter insertion. C. Rhodolaparoscopic ligation of bile stump. D. Follow up as it will heal on its own. इसका आंसर है A. ERCP with or without stent. Question number 18. A patient has undergone laparoscopic cholecystectomy and is under post-operative observation. Drain kept shows bile fluid. USG is normal. Patient is afebrile. MRCP shows 200 cc collection. What is the immediate next step? A. Close observation. B. Urgent percutaneous drainage. C. Redo laparoscopic ligation of bile stem. D. Laparotomy. इसका आंसर है B. Urgent percutaneous drainage. Question number 19. Which of the following hernia is being operated in the image given below? A. Litter's hernia. B. Amygdal's hernia. C. Gibbon's hernia. D. Richter's hernia. इसका आंसर है A. Litter's hernia. Question number 20. Identify the wrong statement about late dumping syndrome from the following. A. Symptoms start after 2 hours of food intake. B. Symptom worsen with physical activity. C. Symptoms are relieved on lying down. D. Clinical features include tremors, dizziness and palpitations. इसका आंसर है C. Symptoms are relieved on lying down. Question number 21. Identify the wrong statement from the following. A. Ileostomy loop is generally capped with pouting. B. Maximum malabsorption of electrolytes and nutrients is seen with colostomy. C. Stoma of colostomy is averted above skin level. D. Only muscular layer is taken in sutures while creating ileostomy. इसका आंसर है C. Stoma of colostomy is averted above skin level. Question number 22. Arrange the following steps of surgery in order. A. Creating pneumoperitoneum. B. Dissection of hepatocystic triangle. C. Ligation of cystic duct and artery. डी सेपरेशन ऑफ गॉल ब्लैडर फ्रॉम लिवर बेड। इसका आंसर है ए बी सी एंड डी करेक्ट ऑर्डर। क्वेश्चन नंबर 23, द एंगल बिटवीन टू वर्किंग पोर्ट्स इन लेप्रोस्कोपिक सर्जरी। ए azimuth एंगल, बी एलिवेशन एंगल, सी मैनिपुलेशन एंगल, डी एक्सट्रीम एंगल। इसका आंसर है सी मैनिपुलेशन एंगल। 24, क्वेश्चन नंबर 24, हाई टिश्यू इन्फ्लामेशन रिएक्शन सीन विद विच suture material? ए polyglactin, बी polydioxanone, सी polyglycaprone, सी एंड डी कैटगट। इसका आंसर है डी कैटगट।